Hi, everyone. Welcome back to MadBarn Academy. And if this is your first time tuning in, then welcome. We hope to earn your subscription today. I'm Dr. Fran Rowe, one of the veterinary nutritionists here at MadBarn. And today I wanted to piggyback off of last week's video about post-foaling benchmarks and dive a little bit deeper into the importance of colostrum for foals. If you haven't seen the video on post-foaling benchmarks yet, I've included a link in the description below. Be sure to check that out, especially if you have a mare that's ready to foal in the coming months or you're planning on foaling out next year. Okay, let's get started on our deep dive today, colostrum and why it's so important for the newborn foal. So colostrum is the first milk that the mare produces. Over about 24 to 48 hours, that colostrum will transition into true milk. The composition and appearance of colostrum is very different than milk. It's thick, yellow, and really sticky if you get it on your hands, whereas milk is more thin, white, still a little bit sticky if you get it on your hands, but much less so. Colostrum is much higher in proteins, certain vitamins and minerals, sugars, and fats compared to milk. And most notably, it's concentrated with immunoglobulins, also called antibodies. Antibodies, or immunoglobulins, are protective proteins produced by the immune system. Their job is to circulate around the bloodstream and identify foreign substances, harmful pathogens like bacteria, fungi, parasites, etc. They'll bind to these substances, generally what we call an antigen, and stimulate the immune system to come and destroy it, thus protecting the body from infection. You can kind of think of every antigen as a unique key where there will be a matching antibody lock that the key fits into. So sometimes, obviously, we're exposed to brand new pathogens that we've never seen before. That antigen key doesn't fit into any antibody lock. This stimulates an immune response where our body fights off that foreign invader. Eventually, the body produces a specific antibody to remember that antigen by for next time. This process describes active immunity, where the body is actively generating new antibodies in response to novel pathogens. This concept is how many vaccines work and why we're immune to certain diseases after having been sick. The body remembers. Now, under certain conditions, it's possible to transfer those protective antibodies from one individual to another, and this is termed passive immunity. One of the best examples of the transfer of passive immunity is intake of colostrum by the newborn, like the foal. Foals are born with a naive immune system, meaning their immune system is basically a blank slate. Passive transfer of immunity through colostrum essentially provides a surrogate immune system for the foal until that foal can develop its own immune system. Passive transfer of immunity provides immediate but short-term protection. In horses, maternal antibodies begin to wane about 4 to 6 months of age. When a newborn foal consumes colostrum, those immunoglobulins are absorbed from the small intestine. However, the gut is only open to absorb these large molecules during the first 24 hours of life. And in fact, most absorption occurs in the first 12 hours of life, with absorption rates decreasing by about 80% after 12 hours. After that 24-hour mark, the gut is officially closed and no immunoglobulins will be absorbed. So foals need to consume a lot of colostrum within this critical window to confer adequate passive immunity. Those that do not meet this threshold would be considered failure of passive transfer, or FPT. We assess passive transfer of immunity by measuring IgG levels in the foal's blood. IgG is the most abundant immunoglobulin in colostrum and the body, so it's a good marker to measure. We're aiming for IgG levels of 800 milligrams per deciliter or higher. Foals that are less than 800 would be considered FPT. And you can further classify that as potentially partial failure or complete failure, depending on the level. There are several different tests to measure IgG nowadays, and measuring IgG is the standard protocol at a foal's first wellness exam at about that 24-hour-old time. So some different tests include SRID, which is the gold standard and very accurate, but it takes about 24-hour turnaround to receive results. There are a couple different turbidity tests available, like using zinc sulfate, latex agglutination, and then ELISA, such as the SNAP IgG foal test, which is pictured here. And this test in particular has become popular with veterinarians because it's rapid and stall side, so it can be done right there on the farm while you're looking at that foal. So in this picture, this example, this Foals test has come back as adequate or greater than 800, as indicated by the dark blue middle dot. So the reason that all of this matters, and we go to the trouble of ensuring that foals are nursing and measuring their IgG, etc., is because failure of passive transfer foals are at a significant risk of life-threatening infection. These foals can become very sick very rapidly, just days after being born, if they do not have those protective antibodies circulating in their bloodstream. So some of the most common illnesses these foals suffer from include severe GI infection and diarrhea, pneumonia, umbilical infection, joint sepsis, and certainly generalized sepsis. So without aggressive medical intervention, many of these foals will not survive. So what are some of the key factors that influence passive transfer of immunity with regards to colostrum and the newborn foal? Well, the two main parties involved in passive transfer are the mare and the foal. So the mare has to produce enough colostrum for that foal, and the foal has to be able to ingest it. If something goes wrong with either party, then adequate passive transfer will not take place. Factors that we can attribute to the dam include the quantity and quality of the colostrum produced. If the mare does not produce enough high quality colostrum, then passive transfer to the foal will be inadequate. Factors that we can attribute to the foal include the foal's ability or potential lack thereof to consume enough colostrum during the necessary window. So let's break down each of these factors a little bit more. So with regards to the quantity of colostrum produced by the mare or the quantity available to the foal, the good news is that the vast majority of mares will produce an adequate amount of colostrum for their foal. There are a few scenarios that may negatively impact or negatively affect milk yield and thus colostrum production, such as if the mare is young, maiden, or in poor body condition prior to foaling. Maiden mares are first-time mothers, while multiparous mares have had one or more foals in their lifetime. Two other scenarios worth mentioning include premature lactation and agalactia, which are two abnormal scenarios with regards to the mare's milk production and lactation. So the first refers to when the mare develops an udder abnormally early and may even begin leaking milk well in advance of foaling. In some cases, these mares will leak out all of their colostrum, leaving none for the foal by the time it's born. This is a common complication in mares with placentitis, for example. The second, agalactia, refers to a mare that develops no udder and fails to produce any milk at all. This is a common complication in cases of fescue toxicosis, in which mares graze on endophyte infected fescue pasture or hay. I've included links to both of these conditions in the description below if you'd like to read more about them specifically, but it would be a little bit too much to go into for today. When we talk about colostrum quality, we're usually talking about the level of immunoglobulin in that colostrum. Again, most mares will produce good quality colostrum, but remember, the antibodies in that colostrum will mirror the mare's own immune system. So, in order to beef up colostrum quality, it's standard that mares receive pre-foaling vaccines about a month prior to foaling. This stimulates antibody production to those pathogens, the ones that you're vaccinating against, which will load the colostrum with extra antibodies. So, core vaccines for all horses in North America include rabies, tetanus, West Nile virus, Eastern encephalitis virus, and Western encephalitis virus. And then certainly there are risk-based vaccines that are going to depend on your area of North America and the risk of exposure to those pathogens. So it's important to chat with your veterinarian to determine what vaccines make the most sense for that mare and subsequently for that foal. So colostrum quality will also be dependent on the mare's overall nutrition during pregnancy and then particularly late pregnancy when she's getting ready to transition into lactation. During this time, she'll need extra energy and protein to supply the growing fetus and prepare for lactation. Ensuring balanced vitamin and mineral intake for the mare ensures that her milk will also be highly fortified to support the foal. Additionally, research has shown that supplementing the mare with yeast probiotics and DHA and omega-3 fatty acid during gestation is beneficial to the foal as well. The last factor to consider, and the one that probably most everyone tends to focus on, is ensuring that the foal consumes enough colostrum during that critical time frame. A healthy, normal foal should be up and suckling within 2 hours of birth. And they must consume about 2 to 3 liters of colostrum within that first 12 hours of life, which is that window in which the gut is open to absorb antibodies into the bloodstream. There are many reasons why a foal may not meet this benchmark. Examples include premature birth, foals that are slow to stand and suckle or potentially unable to do so at all, foals with an abnormal or weak latch and suckle reflex, and certainly foals that have been rejected by the mare or orphaned. So at the end of the day or night, since most mares foal in the middle of the night, if you're concerned about your foal's ability to get enough colostrum, call your vet for assistance. Prompt intervention is key for the foal's health and survival. So your foal will determine the best treatment plan using a combination of history, physical exam of the foal, and testing IgG levels. Foals that are less than 12 hours old are still good candidates to receive passive transfer of immunity from colostrum because their gut is still open. So your vet may tube the foal with donor colostrum or frozen colostrum that's been thawed. If the foal is greater than 12 hours old, then administration of protective antibodies will come in the form of hyperimmunized plasma, which would be given through an IV catheter. Alrighty, you guys, here are references for today. And thanks so much for listening. Don't forget to like and subscribe. Explore the other videos on our channel. We've got lots coming out all the time on various topics. And don't forget to check out the additional links I've provided in the description below if you want to learn more about foaling, colostrum, and managing the pregnant and lactating mare. All right, until next time.